I'm Maddie Ghorashi, Government and Public Affairs Manager with American Medical Response Ambulance. AMR is the leading medical transportation company in America. We have over 38,000 employees across the nation, and our local operation here employs approximately 1,200 caretakers, paramedics, EMTs, nurses, and we respond to over 200,000 emergency 911 calls a year. In 2017, we set the goal to help support the county in their effort to reduce accidental overdose deaths. And we partnered with a group of individuals, including the Safe Homes Coalition. Their mission was to reduce overdose deaths. And this year, we've partnered with the county, participating in supporting Supervisor Nathan Fletcher's and Dr. Wilma Wooten's announcement earlier this year that they will be making the life-saving medication Narcan or Naloxone widely available throughout the community. And then we also supported the DA in her Fight Fentanyl event in National City. And today we're really honored, Marla, and thank you for inviting us to be here supporting Marla Kincaid and the Prescription Drug Task Force. Our paramedics are definitely seeing an uptick in overdoses and an uptick in their Narcan administration with the recent pandemic. And our paramedics see this problem nearly every single day. They see the suffering, not just those folks who are addicted, but also the families who are suffering as a result. And it's really personal to us. So you'll just hear how personal this is to us from Susan Monroe, who is here today. She is a paramedic, and she's going to tell you a short story about kind of what she sees in the field. And then later in the presentation, she'll also be demonstrating on how easy it is to save a life with Narcan. So I think I'll close by letting you know that AMR is committed to helping support this task force in any way we can, Marla, and thank you for having us today. Susan, I'll kick it off to you.
Thanks a lot, Maddie. As Maddie said, my name is Susan Monroe. I'm a paramedic with American Medical Response, and I've been with them now for 31 years. When we are talking about overdoses, we hear so much about numbers and statistics. Well, for us out in the field, those numbers and statistics come with family, with lives that are being affected and destroyed because of it. Just to give you an example, this year alone, we have had so many more overdoses, and one that really I remember and touched my heart was arriving on scene and seeing this gentleman as we approach, and he's upset and screaming and pulling off the porch rail, and I'm thinking he's making access for us. It turns out this is the overdose, the gentleman's father. As we arrive in, we walk in and we see the mother. She's crying. She's clinging to a younger sibling, about 10 to 12, and that young girl is crying. And past them, we see an 18-year-old just laying on the ground with sheriff doing CPR. At this point, it's gone so far into the overdose, not only has he quit breathing, but his heart isn't beating any longer. Now, we strive at AMR to be to every emergency response within 10 minutes, which isn't a long time, but unfortunately with overdoses, sometimes that's too long. We got there, and even with all of our training and all of our equipment and everything that we did for this young gentleman, it wasn't enough. We could not bring him back. We could not save him. And that's why this program is so important. Having Narcan available for the public to administer early on can make the difference between life and death. It might have changed the outcome for this call had the family had that available for him. So as I said, these aren't just numbers and statistics to us. They're people. Their lives being affected and destroyed, families being destroyed. So please take advantage of this program, utilize the Narcan, pick it up, have it available. You could save a life. Thank you.
So this is UPATH, which stands for Parents for Addiction Treatment and Healing. This is our opioid overdose and prevention response program. I am the Director of Operations at UPATH, as well as the Program Manager for the Naloxone Distribution Project. Just to give you a little bit more about A New Path, we are a nonprofit advocacy organization of parents, concerned citizens, individuals in recovery, healthcare professionals, community leaders. Our mission is to reduce the stigma associated with addictive illness through education and compassionate support, and to advocate for therapeutic rather than punitive drug policies. A New Path was founded in 1999, and we strive to ensure access to quality, cost-effective addiction treatment services, lessen harms associated with addictive illness, reduce recidivism, and save lives. This project is specifically part of our Ask Mom How to Save a Life project. It's A New Path's National Moms United to End the War on Drugs campaign. We are in 35 states with different moms handing out Narcan and clean syringes out of the trunks of their car, or with an NDP project just like ours, where they're distributing through the grant that they receive through Department of Healthcare Services. But that is in 35 states. We have partners across those 35 states, and we're also in 5 countries. So they are trying to do, we are trying to have all of our harm reduction efforts go across borders. We just started our Mothers Across Borders campaign, where we are trying to advocate for harm reduction across the border, or people who are crossing the border to use in Tijuana, or if they are vice versa are coming into use here in the United States, that we want them well equipped with Narcan or resources for them to be able to make sure that they can save their own lives, or that they can receive treatment. And we're trying to further that harm reduction conversation across borders as well. Just to let you know that A New Path testified in California in 2014 at the inception of all of this here in like San Diego, I guess, if you want to put it this way. But we went to Sacramento to talk about how important it is for the Naloxone access bill to be passed, because A New Path started as a parent group where there were parents with my executive director and 2 other founders who had nowhere to go when their kids were in the height of their addiction. If they got kicked out of detox, or if they got kicked out of their programs, they didn't have any options and they felt like they were alone. So they started A New Path to have this support group, if you want to put it that way. And then it turned into advocacy, changing policy, and then having this program come up. So in 2014, we testified to make sure that parents, who usually are the first responders, kind of like Susan's story, that she went on scene, it was the family, it was the parents, they were all distraught, they're all having a hard time because someone that they love is passing away in front of them. This helps these families, any family, friends, anything like that. If they have Narcan, they are the first responder before the emergency medical professionals arrive, and it gives them the chance to be able to save someone's life. And by that time, so that they can have the ambulance get there in time, they have the Narcan in their system, they're able to reverse that overdose, and then they're able to be helped by emergency medical professionals after that. So we helped pass the Naloxone access bill to provide naloxone distribution under a standing order from a licensed physician. And now that is provided by the state because of the widespread naloxone access efforts that they're trying to have in all of the counties. And we also provide free group and individual trainings for naloxone in San Diego County. So this training is completely free. The naloxone is completely free. So we actually ask everybody, as kind of a call to action, if they can share this information for these trainings to at least one person in conversation, at work, at a school site, if you're at a PTA meeting, things like that. It helps get the conversation going for people to start learning about Narcan and harm reduction. Since 2014, A New Path has trained over 9,000 individuals how to recognize and respond to an opioid-related overdose and how to administer Narcan. And in the past 6 years, our program has reported 2,067 opioid overdose reversals from the use of Narcan during accidental overdose. So that is parents, that is friends, that is people at work in the sober living homes, treatment centers, detox facilities. These are people on the street, the homeless population. In the past month and a half, I believe we had 168 of those saves just in the past month and a half, mostly in the North County area, in Oceanside, Vista, I believe, Encinitas, and in those areas. So this is not going in the direction that we want it to go. We want more lives to be saved, but we also want less overdose. So just to let you know about more your training program details, you'll learn about opioids today, naloxone or Narcan, they're both the same thing, symptoms of an opioid overdose, how to get into contact with emergency medical services during an opioid overdose, how to respond to it, how to use Narcan in the case of an opioid overdose, and how to obtain Narcan and your refill procedure if need be. I'm sure you've all seen these stats a million times over, but just kind of to hone in on why this program is so important. In 2019, 152 people died of fentanyl-related death. That's just fentanyl. And then in 2020, it rose to 461 fentanyl-related deaths in San Diego County. Since the beginning of 2019, drug-related deaths grew 13% in the United States. So that kind of gives you an idea of the direction we're going, and it's the wrong direction. If you don't know anything about Narcan at all, it only works for opioids. It does not work for any other drugs. It doesn't work for meth, cocaine, speed. It doesn't work for benzodiazepines. So if you don't know what the opioid classifications are, the ones that it does work for is heroin, morphine, codeine, oxycodone, prescription painkillers like Vicodin or Percocet, fentanyl and carfentanil, which are synthetic analogs of opioids. We do know that it does work for those, and that we just have heard sometimes when people have reported these rescues that it might take just a little bit more Narcan when it comes to fentanyl, but it still works against fentanyl. What is naloxone? Naloxone is a prescription medication that reverses an opioid overdose. It cannot be used to get high. It's non-addictive. Naloxone is safe and effective. Paramedics and doctors have used it for decades. It also goes by the brand name Narcan. You will probably hear Narcan more than you will ever hear naloxone, but no matter which term you hear, they're both the same medication. So if someone says one or the other, it does not matter. The medication is the same. The procedure is the same. And naloxone is an opioid antagonist, so it blocks the drug from hitting the receptor. So that's why the person can have their overdose reversed, is because the drug is not able to hit that receptor in the brain. These are different types of naloxone or Narcan. So like I said, no matter which one you receive, what you will be receiving is the bottom left corner of the Adapt Pharma nasal spray. So that's the Narcan nasal spray. It's kind of like a nasal auto injector. It's single dose. Each kit has 2 doses of that nasal spray. But if you were to receive naloxone hydrochloride in the top left corner, the Evzio, basically like EpiPen version of the intramuscular injection in the top right corner, or the naloxone hydrochloride in the bottom right corner, which is probably what you would see in a hospital setting if you were in the emergency room, or if you went to the hospital to further care for that overdose, you might see that version. But no matter which version you have, everything is still the same. So what happens when someone goes into an opioid overdose? If you take a look at the diagram on the right, it technically shows what it would look like in the brain if someone was to go through an opioid overdose. So you see the receptors in the brain. There are so many of these receptors. When someone's taking an opioid, I mean, if anyone's ever taken one, or even if you haven't, you know the purpose of them. It makes somebody feel better because if they're feeling pain, if it's for prescription purposes, it takes the pain away. They're feeling so much better. The receptor has been taken over, so they don't feel any of that. If it's someone who's using it to potentially abuse, they're getting high, it makes them feel better. It doesn't, it has such a good effect, if you want to put it that way, and that's why people get so addicted to it. So what happens when someone goes through an opioid overdose? The opioid sits on all of those receptors in the brain. When they've taken too much of the opioid, it takes over all of those receptors, and too much of the opioids fitting into too many receptors slow and stop the breathing. So you can see those opioids sitting on the receptor in the brain. When you use Narcan, what happens when you reverse an opioid overdose? You can see in the same diagram basically, but now Narcan is sitting on the receptor. Narcan has a stronger affinity to the opioid receptors than the opioids themselves, like heroin, Percocet, OxyContin, things like that. So it knocks the opioid off the receptor for a short period of time. This is a lot of, we got a lot of backlash in the beginning of this program about, enabling people to use things like that. We are trying to save people's lives. We don't want any more people overdosing from opioid overdose. So this is like I said, it buys you time as a first responder before emergency medical professionals get there. So, hopefully you have that time to where they start breathing again. Hopefully they don't overdose again, but if anything, since the procedure, you are taking the overdose procedure, once the emergency medical services arrives, they're able to be further rescued because you have just bought time for them to wait technically for the ambulance to get there. So it reverses the opioid overdose and it makes the person breathe again. So it's kind of reminding that person that those receptors are there to remind them to breathe. But you can still see in the background that the opioid is floating around in the brain still. So that's why it's a very short acting drug, because as soon as Narcan wears off and gets off of those receptors, the opioid can go back on and they can OD again. Just a little bit more about overdoses. If you don't know this information already, they can be instantaneous or over a longer period of time. They can happen as a process. Someone could slowly stop breathing. They can usually happen 1 to 3 hours after a drug was used if a person is actively using. So to touch on this a little bit more, if someone is actively using, so this could be prescription from their doctor, take 1 pill of Vicodin every 6 hours as needed for pain, and you are using that prescription properly, you are taking it as directed by your doctor, but you are using that opioid all day long. So those receptors are being used all day long by this opioid. So if they were to say, you know what, at the end of the day, I'm done with work, I don't need to worry about anything, I'm like gonna have a nice time at home and just watch some TV, but I'm gonna take 2 pills versus 1, because those receptors have been used all day long, just that little bit more can make them overdose. And it can be 1 to 3 hours after, because their body is already used to having it in their system. So the symptoms might not be as prevalent as somebody who can have an overdose instantaneously. So that could be, like I said, prescription drugs, or it can be illicit drugs like heroin. It could be counterfeit pills like, the Xanny bars pressed with fentanyl, things like that. But it can happen later if someone's actively using. With fentanyl or carfentanil, it can happen instantaneously. So if you look at the picture on the left, it shows you lethal doses of fentanyl and carfentanil relative to lethal doses of heroin. If you look at the vial of heroin, it looks like 0.5 milligrams. You move over to carfentanil, it looks like there's just residue in there and that there's not even anything in there. And if you look at fentanyl, it looks like a pinch of salt sprinkles. Fentanyl is 50 to 100 times stronger than heroin, and carfentanil is 300 times stronger than heroin. So that shows you why people can overdose instantaneously with fentanyl and carfentanil, because of their potency. So that's why they can go out so much faster than any other opioid. With new users, any opioid can make them go out instantaneously because they've never had it in their system before. It's never had to be digested, atomized, things like that. People could have a reaction to it if they've never taken it. Someone found dead with a needle in their arm is a rare event that's sensationalized. We train lots and lots of parents, and a lot of parents who have never seen opioid overdose or even know what to look for. So I get asked a lot of questions like, I see this on TV, I watched this movie, they saw their children with a needle in their arm and tourniquet still attached, they had a mouthful of pills. Most likely you will not see something like that. It's not that it can't happen or not that you'll never see that, but it's definitely rare for you to come across a scene like that. Fentanyl safety tips. There is a lot of stuff going on in the news about fentanyl. There is a lot of like myth versus fact type things going on. Like if you came into a room with powdered fentanyl, you can OD because it could be in the air. So we just kind of want to go over some safety tips for if you do come into contact with fentanyl and how to take care of that. So if you touch fentanyl, whatever form, powdered fentanyl, things like that, if you touch it, it can be removed from skin with soap and water. I like to compare it to the pandemic. They always tell you if you wash your hands with soap and water, that is the best way to make sure you get everything off of your hands, because it binds with the soap and with the water and you get to rinse it off. If you were to use alcohol-based products such as hand sanitizer or wipes, it may increase fentanyl absorption. A lot of misunderstanding about this because they think if you use alcohol that it could open the pores and then you get the fentanyl into your skin that way, and that's how the person ODs. Basically, no, it's not like that. Same thing, like I said, like in comparison to the pandemic, if you're using alcohol, but you don't go wash your hands later, you might still have traces of fentanyl on your hand. Maybe you go eat, you ingest it, you adjust your contact, you ingest it through your eyes. You maybe have to blow your nose or something like that, and you get it on your nose while blowing your nose. That is how you absorb the fentanyl, is by ingestion. So if you know that maybe you come into contact with fentanyl during a rescue and it ended up on your hands, your arms, something something like that, just be aware of it. But because we're talking in terms of you saving someone's life who is not breathing, that's why the next bullet says wash your hands soon, but not necessarily immediately. That's because the person who is not breathing versus you who know you have fentanyl on your skin or wherever it might be located is more important for you to rescue that person and get them taken care of. Then you can go wash your hands after. Powdered fentanyl does not penetrate the skin very easily, but like I said, avoid touching lips or eyes. There's no need for special gear or double gloving. One pair of nitrile gloves is enough if you have it. If not, same thing, hand washing. And then carry naloxone and be familiar with it for both your patient and your partners. So going into signs and symptoms of an opioid overdose and making sure you know the difference between when you should and when you should not inject someone. I get a lot of questions. Well, if they're really high, I don't want them to overdose, so can't I just give it to them then? The answer to that is no. It's responsive versus unresponsive, and people like to, wonder why we say that. The biggest reason is because your naloxone supply might not be, you might not have a lot of naloxone. You might only have one kit on yourself. If you inject somebody with that one kit that you have in those 2 doses when they're really high, if that overdose wears off later, you've just used your supply of Narcan and you're not able to rescue that person or other people if you don't have Narcan anymore. So it's if someone is unresponsive is when you want to inject them with Narcan. This is an opioid overdose reversal drug, not a I'm going to get rid of your high drug. So these are the symptoms that you want to compare when you do and do not administer Narcan. So really high, they might have relaxed muscles. They could have speech that is slow or slurred, but they are still talking to you. They could be sleepy looking with very tired eyes, nodding. So that's like maybe you look at them, you're having a conversation. It's the head nod, but they come back up and they always are present again after they doze off. And then responsive to stimulation like yelling or the sternum rub. So they are responsive. If they're overdosing, they could have a deep snoring or gurgling. We like to tell parents if they've never noticed that their child has snored before, that could be the use of opioids because their respiratory system is being affected because their brain is not reminding them to breathe properly. So the death rattle is a big thing when the body is trying to breathe and it can't because it does not remember to because their receptors are taken over. Very infrequent or no breathing, pale or clammy skin, heavy nod. This is involuntary positioning. If you were to walk into a room, you saw me on this couch back here, my like nice little fake virtual couch. But if I was passed out over my lap and I was in a weird position, my arms are hanging down, or if you see me passed out over the side and I'm bent all weird sideways, it's not comfortable positioning. I had a parent tell me they walked into the room and their son had their butt up in the air and they were sleeping with their butt up in the air. That's not normal. You wouldn't sit there being like, I need to go tuck my child in. That looks totally fine for my 17, my 22, whatever year old child. Involuntary positioning. So that's the heavy nod. Not responsive to stimulation. So if you're kind of shaking them around gently a little bit, you're yelling at them, trying to get them to wake up and be shocked by waking them up, and they're not responsive. That's a big thing. And then slow heartbeat or pulse, that's for if you know how to check heartbeat or pulse, because this doesn't have anything to do with your heart. It has everything to do with what's going on in the brain. But also if it has been long enough, you might not feel a slow heartbeat or pulse. So that's why it's on there, but I don't like to encourage you to try that way. Everything else is kind of the way I'd like you to look at these symptoms. Other signs and symptoms of an opioid overdose, they could have a limp body, face is pale, pulse or heartbeat is slow, erratic, or not there at all. They could be throwing up or have thrown up, passing out or have passed out. Choking sounds or the gurgling noise, very slow or regular breathing, or that breathing has completely stopped. Awake but unable to respond. So I hear a lot of stories about eyes being open but not responsive. And then blue or ashy skin tinge, usually in the lips and fingertips, show first. So those are signs and symptoms of an opioid overdose. So responsive versus unresponsive. Unresponsive is when you want to administer the Narcan. So you've identified that you think you're seeing an overdose. You've seen enough to be worried, and now you check on them by tapping their foot, asking them if they're all right or okay, saying something alarming. We say this because this is a non-harmful way to try and wake someone up. Naturally, people don't want to get in trouble. Most people really don't. So if you're saying something like, your mom is coming, a cop is coming, if you're at detox, your sober living home manager is coming, they don't want to be in trouble. So you trying to wake them up, that in that way versus this is the point where I hear a lot of people tell me their horror stories of seeing that they know that this person is overdosing. So they put them in an ice cold bath, they punch them in the face, they do things that they think by shocking them will wake them up. Those only cause more harm and waste time when it comes to the reversal. So that's kind of the safe ways for you to try and see if you can wake a person up. If they don't respond to those nice, gentle ways of you trying to wake them, then you're going to do the sternum rub, which is taking the top of your knuckles and then raking across your breastbone like this. I ask you to do this to yourself right now, because if you've never done it before, it's really uncomfortable. It's painful enough where it's not going to hurt you, but painful enough where it's, if someone is a little bit responsive, they're going to knock your hand off and be like, get off of me, that hurts. If they don't respond to that, that's enough pain for you to know that they're probably overdosing. So if there's no response, you do the sternum rub. And if there's still no response, that's when you go into your overdose procedure and call 911. A lot of questions I get, well, what if they are having a heart attack? What if it's a seizure? What if it's a stroke? And I'm doing the sternum rub and they're not responsive and I give them Narcan. What is that going to do if they give them Narcan? Narcan won't do anything to anybody who's not on an opioid. It is like water. I actually don't even think there have been any allergies to Narcan in the time that it's been around. So if I was to inject myself with Narcan right now, being fully present, not on opioids, it's probably going to be like Flonase or a saline solution that's going into my nose because it has nothing to counteract in the brain. So if it was to be any other kind of medical emergency, Narcan will not make that medical emergency any worse. So because you are also going into overdose procedure, these steps also, not in terms of an opioid overdose, you've already called 911, you've told them where you are and that someone's not breathing. The paramedics are going to be on their way. So no matter what the emergency is, this person will be taken care of. So if it is an opioid overdose, then we'll go into the opioid overdose procedure. So you've seen all of those things, you've called 911, you're worried about this person, you let them know that someone has stopped breathing. If there's someone else in the room and someone able to help you, you can go ahead and tell them to call 911 and then someone starts rescue breathing. A lot of people, we train a lot of sober living homes and treatment facilities, like I said, who are telling us that they will not be doing rescue breathing because we are in the midst of a pandemic still. We totally understand. It's per your policies and procedures. If this is you on your own, if you're trying to be an overdose vigilante on the street and you want to go and save people that you see overdosing in, alleyways, or if someone overdoses at a club, something like that, you can rescue breathe on your own if you want to and you are comfortable with doing that during the pandemic. But we also understand if you don't rescue breathe, it's kind of just like an additional thing in the process. But what is going to rescue someone from an opioid overdose is the Narcan. So these are the 6 steps you're going to want to take during an opioid overdose reversal. Steps 2 and 5 can be taken out if need be. So you've called 911, you might rescue breathe. And if you do, just take 3 big breaths because you don't want to sit there trying to make someone breathe off your breath because you have Narcan. It's just to see if they can respond to it. And if not, then you're going to administer your first dose. If after the first dose, they wake up 20 to 40 seconds later, maybe no more than a minute, you want to let them know that you've rescued them and that the ambulance is on the way. Like I said, since Narcan is a short-acting drug, after that first dose, they wake up, they're responsive. Maybe the ambulance is stuck in traffic. They're not able to get there yet. Maybe the Narcan wears off and they OD again. So that's another reason why there's the second dose in there, is because you can reverse the second overdose after while you're waiting if they do overdose again. So whether you use 1 for however many doses of Narcan that you have while you're waiting for the ambulance to get there, these are the steps you want to take. And then the last one is make sure that you seek or you stay with the person until emergency medical services arrive so you can let them know what you did. And then you can also make sure that that person makes it to the ambulance after you've administered the Narcan. So I'm going to stop my share really quick so that Susan can show you in her demonstration what it actually looks like to administer Narcan.
So at this point, as April said, you called 911 and you've identified that you have a potential overdose victim. It's very simple to administer. It's very simple to save a life. If you can do this, you can save a life. Your Narcan is going to come in a small package. What you're simply going to do is open the cover to that package. If you do forget, there are instructions, but again, this is a very simple technique. You're going to remove your little Narcan atomizer. putting your thumb on the little red plunger at the bottom and your 2 fingers on the top. And all you're simply going to do at this point is put the little tip of it into the person's nose. It doesn't matter which side. Make sure that it's in the nostril about a ½ inch or so, because you don't want any of it to come out, and simply push on that red plunger. You're going to hold it for about 10 to 15 seconds. You want to make sure that this all atomizes up into the nose. Once you've waited, go ahead and remove it. And then at this point, because you are reversing that overdose, they may vomit. So you can either turn your patient over to the side, or if for some reason they're too heavy, you have an injury, you can't do that, then turn their head. That way, if they do vomit, they're not going to choke on it or suck it back into their lungs. Again, you want to make sure that you've called 911. You're watching this person. It's not like TV where they're going to immediately start breathing in a second or two. It may take even a minute or two. Go ahead and just watch them. If you do want to give rescue breathings, as just explained, feel free to do that. Keep an eye on them. Watch out for the ambulance. Make sure that your door is unlocked if you're inside. And again, if this is a fentanyl overdose, after a minute or two, if they're not coming around, if you're not seeing an increase in their breathing, their chest isn't starting to rise and fall, they're starting to move around a bit, at that point, you may need to go ahead and repeat the procedure with your second atomizer. But don't forget, this is a life-threatening event. You do need to call 911, watch the person. You can make the difference between this person living or dying just by having that Narcan available and using it immediately. You can make that difference. Again, we're coming with all of our knowledge and our equipment, but we are several minutes out. So please, again, don't be afraid to give this Narcan. If you give the Narcan, they don't need it. It's like taking a Tylenol if you don't have a headache. You're not going to hurt them. Give the Narcan. You can save a life by doing that. Thank you.
Thank you, Susan. Appreciate the actual hands-on training. It's always nice to see versus me having slides showing what hands look like on plungers and things like that. So it's nice to see it done. So I really appreciate that part of the training as well. It's very helpful and for people to actually see it. So I will start sharing my screen again. We're almost at the end of the presentation. So those were the 6 steps. If you go on, a lot of reasons people don't call 911, and I want to go over the California Good Samaritan law, is because some people might have warrants out for their arrest, felony or misdemeanor priors. They might have possession of something. We're not encouraging drug use by any means, but we're not trying to get people thrown in jail. We don't want them to get thrown in jail after they're trying to rescue somebody, or for the person who's overdosing going to get arrested or things like that. So in good faith, because the California Good Samaritan law was passed, you and the person you are rescuing are free from arrest or incarceration. Like I said, there are a lot of people who are really skittish about that, and we understand, but we want everyone to remember that this 911 Good Sam law protects them. If you call 911 for help, you are protected. You are not protected if you don't call 911 and you're administering Narcan and somehow, police arrive on the scene somehow or something like that. You are not protected. So we encourage everybody, as soon as they see an opioid overdose, even if they think that person has felony, priors, if they have a warrant out for their arrest, you want them to have their lives saved. I've heard so many heartbreaking stories of friends or family members who might be using together and they leave someone behind and they don't rescue them, or they give them Narcan but run away because they don't want to get quote unquote caught. So these people pass away, and it's very, very unfortunate because they think that they are not protected. From the people who have reported saves to us, for the most part, they told us if a police did come with that ambulance, if they did ask them to turn out their pockets or search their car or something, as soon as they said Good Sam law, they left them alone. So this protects you and the person you're rescuing from arrest or incarceration. Like Susan said, this is recovery position. So there are multiple reasons for you to put someone in recovery position. So after the procedure is done and you're done giving them Narcan and everything like that, you put them on their side so they don't vomit, so they can't choke on it, aspirate, things like that. What you do, this is if any period of time that you need to leave someone alone. If you need to run into the next room to get Narcan because it's not in the room that they overdosed in. If you need to go get a phone because it's not in the same room, to call 911. No matter how long, of course, you don't want to be taking too long because this person's not breathing. But if you have to step away from them for any period of time, recovery position is the way that you want to leave them. So that's on their side, like in the diagram number 4. Place the bottom arm under the head, top leg crossed over the body, knee should be bent for stability. If you cannot roll this person over, and you are unable to turn them fully onto their side, like Susan said, just turn their head to the side. So this protects them from vomiting, aspirating, choking, getting pneumonia later or something. Also, if you put them in recovery position, if they tried to get up, at least they're kind of on their side. They won't get a concussion. They can't hit their head, like roll off of something and hit their head because they are in a stable position. Responding when this person comes to, you want to make sure you let them know what happened, that they've overdosed and you administered Narcan. You understand that they're not feeling well and that they're in withdrawal, but you want to stay with them and monitor their breathing. You want to inform them that Narcan wears off in 20 to 90 minutes. We've been hearing with cases of fentanyl, it lasts maybe 20 to 30 minutes, some not even that long, depending on how much they used, but the opioid is still in the body and they can OD again. So you want to make sure you let them know that if they try to use again, they're just putting more drugs in the brain, waiting to hit those receptors, and they can OD instantaneously as soon as that Narcan wears off. If paramedics are not coming and you did not call 911, if they were very adamant on not contacting emergency medical services, make sure you make this person go to visit a doctor, go to the clinic, and see check their vitals and see if anything else happened while they were overdosing, because they almost passed away. So you want to make sure they check all the bases. I did have someone tell me that when they got rescued, they were stabbed before they OD'd, but did not know that they were stabbed because they were on fentanyl. So they didn't feel it. And when they got into the ambulance, the people in the ambulance told them that he could have died from bleeding out from the stab wound faster than his overdose because of how severe it was. So you want to make sure that this person is A-okay in all forms, not just with the opioid overdose. So make sure that they seek medical attention if they don't get into that ambulance. What happens if you use your naloxone? When you get your prescription, I mean, this is technically your prescription is taking this training. There's no punishment if you use it. We absolutely want to know and have that report of you using it, because it helps us with our grant to get more free naloxone, to give out more free naloxone in these trainings. We've given out over 10,000 kits in the past 6 years. It is crazy to think about how much we go through. In the past month and a half, we've given out, I think, 2,000 in a month and a half. So it's needed. It needs to be out there. It needs to be in every single person's medicine cabinet. It's also available at the pharmacy without an outside prescription, because in 2014, the pharmacy access bill for pharmacists to be able to prescribe Narcan to people who walk into the pharmacy was passed. A lot of pharmacists do not carry or do not want to do the Narcan training and prescription, but the ones that do, we have heard lots of stories that if it's not a certain healthcare like Maddie, if it's not TRICARE or Kaiser, that Narcan isn't covered in most insurances, and it costs anywhere from $150 to I think $850 is what someone told me. One time when they tried to get it from the pharmacy. So you can go there if you wanted to, but I mean, everything's completely confidential when you get it from us. We encourage you to get it from a new path because it's free, and you won't have to worry about getting that prescription from a pharmacist. But also please, like I said, let us know if you do use it. I hope no one here that does collect a kit has to use it, because I don't want anyone to see an opioid overdose, but I'm happy that anyone who picks it up has it in their toolkit for them to be able to do so. This is my contact information. We will share this PowerPoint, I believe Marla said, that this will be on the PDATF website, and my contact information as well. Like I said, we do these trainings. I do 5 to 6 trainings a week, if not more. We have started going into schools. We were in Mountain Empire recently, Grossmont. We're going up north in the Encinitas area. We train homeless people. There is not any person or any group, any foundation, any organization, treatment center, we will not train. We will train everybody. So if you need this training, if you know someone you can refer this training to, we can do one-on-one at Starbucks. I can do 200 people on Zoom. I can do 50 people in a room, and so can our volunteers. So please, please share this information. The more we get the word out, the more Narcan is in more people's hands, and we can really start dialing those numbers back from opioid overdose.